Hello, good morning. My name is Adam Kaleciński. I'm the owner of our clinic. It's called Noah Clinic, Wrocław, Poland. Sometimes we need implants when patients have no breast at all. So this is a combination then of two surgeries, in fact, breast augmentation and breast uplift, which is considered to be a little bit the most demanding surgery, challenging surgery. In fact, we have to schedule and plan this surgery quite carefully to obtain good effect. This is not the case I performed today. Today I performed only breast uplift. Breast augmentation and uplift. This is, as I said, quite demanding. We shouldn't use very big implants. If we use very big implants, we have the threat of having splitting of the wound above the implant. As you may know, we just introduce implants, and then on the top of the implant we trim the skin envelope to obtain desired shape of breast. Sometimes we have to also play with the gland to obtain good result. Sometimes we have, for example, misshaped breasts, having quite a lot of breast tissue on the outer fragments, after quadrants, or medial quadrants. So we have to modify the shape, and this is also part of this procedure. If we think about breast augmentation and uplift, that sometimes we have to reshape the gland above the implant. This is considered to be the most difficult case if we think of a breast augmentation or breast surgery at all, or at least aesthetic surgeries.